In patients, once the woman is diagnosed with Namaskaram, na peru Dr. Sunita. So first I'll try to explain what happens in this applicator. What we are going to discuss today is exclusively used for gynecological cancers, that is cervical cancer. Okay, so first I'll try to explain about what happens here, and then I know that there are some Telugu reporters also. I can speak in Telugu also for them, right? So for cervical cancer, half of the treatment, especially when you are going for radiotherapy, half of the treatment will be done with external radiation, where will not touch the patient. Okay, the machine will be just revolving around the patient, and there are a lot of recent advances like IGRTs, IMRTs. You must have heard all over the newspapers, channels, and all that. It's a high precision treatment, delivering less dose to the critical organs, and then giving maximum dose to the tumor tissues and all. So that's part of the external radiation. We don't touch the patient there. Then half of the radiation will be delivered through the intracavitary radiation. So where we insert some radioactive materials, that is iodine, iridium 192 source, and this radioactive material will be inserted directly into the uterus. Okay, for cervical cancer, this is the very, very, very important part of the treatment, and there are some patients who get scared because of this second part of the treatment. First part of the treatment, everybody will be happy because it's a painless procedure and all, but the moment we say that we have to give internal radiation to you, the patients will be terrified, thinking that this is going to be very painful, and that the thought itself of this internal radiation will scare these patients, and many of them will be leaving the hospital also. I've seen a lot of dropouts in my 20-25 years of practice, especially because being a lady radiation oncologist, I deal more with these gynecological cancers and breast cancers. So in order to improve this part of the second part of the treatment, that is the brachytherapy or internal radiation, there are several different varieties of treatments in this. Until now, like majority of the institutes usually do this and without anesthesia and a bit painful process. So what we have introduced in our hospital now is we are going to do this in a anesthesia in a theater, operation theater. So the patient, while taking this treatment, will not have any pain. Okay, so the first most important part is this treatment will not be painful for you, and please utilize this procedure. It's not painful. And the second most important thing is the blood loss related to this procedure is also very less. There is a minimal blood loss during the procedure. Okay, and hardly 10 to 15 minutes of procedure. We give one fraction in the morning and the second fraction in the evening, and the same day the patient will be discharged. So this happens for 2 sittings. So this procedure is done, this is a commonly followed procedure all over the world, but what we have with us is this hybrid interstitial brachytherapy applicator, where we can deliver both intracavitary and also interstitial. What it means that interstitial is you insert the needles directly into the cervix. Intracavitary is you insert only one central tandem which goes only into the cervix. So the reason being why we do this interstitial is that it has a higher capacity to deliver radiation dose to the tumor directly, and also the same time you are delivering very less radiation to the surrounding normal structures, critical structures. So if you see the long-term survivors of this cervical cancer, what we find is many of these patients, they develop a lot of rectal reactions. They complain of passing blood through the motion, and then there are some patients who even complain of passing clots in the urine and all. So in order to reduce all these complications and in order to make this process a painless procedure, we have introduced this technique into we have introduced this procedure into our hospital, and I'm very fortunate that the management is so supportive for this, and and that's how we started this process. So if you have any doubts or any questions about this, I can take up. or should I speak in Telugu? Long-term side effects were much more higher in those techniques, and then finally everyone went back to this brachytherapy. So for cervix, there is no treatment. No treatment of radiotherapy for cervix is complete without giving brachytherapy. So that's the first thing. Then the second part of your question: what will be the side effects?